So, Dr. Naeem, you don't accept those findings?
I believe some of the quotes, that were there, the 85% access to health services. That one is not, what the ministry has been saying. But I agree, that insecurity, poverty, culture, they're all barriers, to access health services, and especially in a traditional community like Afghanistan, where we have the mobility of women, especially in rural areas, is limited. And at the same time, the information, about health is also an issue, because the literacy rate in Afghanistan has been very low, especially for women. So those are all major barriers to access health services. But some have. I also noticed in the report that the public facilities are not used. Well, if we compare, some of the reports, and that is verified by a third party that are coming, to the Ministry of Public Health, every year, the number of consultation has been on the increase from 2007 till date. And we have had, about over 42 million consultations in the health facilities. There are about 2,100 health facilities around the country. So I am not very sure, if that was true, because some of the interviews that are done, those are the opinion of the people coming from those remote villages, which I respect very much. But at the same time, it could be a little bit exaggerated as well, because so that they get more assistance. And that has been, what I've been noticing. I have worked for non-governmental organizations as well. So I have, as an Afghan, I know, the culture better, and that usually happens.
All right.
And I also feel...
Dr. Naeem, there's another point then, and we know that this is already the response, actually, of some of Western countries. Look, it's not our fault. It's because the Afghan government is so corrupt that we're not making much headway in Afghanistan. Half this money disappears into Afghan government hands.
Sorry, I didn't get the question well.
Well, it's about Afghan corruption and the corruption of politicians in your own government. That's going to be the reason why the US and others say they've made such little progress, or at least off the progress they've made, it's been so limited over the last 12 years.
Luckily, at least, I'm working for the Ministry of Public Health. We have taken all the measures, to avoid corruption or reduce it. For that purpose, we are contracting service delivery to non-governmental organizations. We are not spending the money ourselves. So basically, in 31 out of 34 provinces, we have contracted out health service delivery to non-governmental organizations. So that way, we are making sure that the money that is allocated for health is spent in a transparent manner, where we can account, for all the donor money and the taxpayer money that's coming, from the donor countries.
Right. Okay. Well, Heather Barr, then, if we look at accountability and oversight, what's so weird is there is oversight almost on a weekly basis. I think we all get emails from the Special Inspector General in Afghanistan saying, hang on, this money's going nowhere, and when it is being spent, it's a complete waste of time. Just recently, we all, I think, got this email about a hospital in Gardez, overpayments of $507,000, paying $500 per gallon for diesel fuel when it shouldn't have been more than $5 a gallon. And indeed, it was a hospital that, once it's completed as operations and maintenance costs are 5 times the cost of the hospital it's replacing, it's probably going to go bust. I mean, the government gets those reports, the US government. Why don't they seem to do anything about it or change their ways?
It's interesting. I mean, the SIGAR reports are very damning indeed. And I think that SIGAR has been playing a much more active role in the last couple of years than previously. So So in a sense, some of this feedback wasn't coming in earlier. But certainly those reports, while they're damning about the Afghan government, they're almost more damning about the U.S. government and the U.S. government's sort of desire to cover their ears and say, no, I can't hear anything you're saying. I think there's a great desire right now to declare victory and go home in Afghanistan.
But
and
from your
anything that gets
experience,
in the
Heather,
way of that narrative.
from
Sorry,
your
what?
experience, how can you spend $600,000 on a new hospital and it not have clean water, it not have electricity, it not have furniture, and it not have equipment?
Well, I've never built a hospital, so I couldn't explain from my own experience how that's possible.
But you were monitoring corruption in Afghanistan.
Yes, I used to run an anti-corruption project for the United Nations, and one of the things that I found incredibly frustrating about that job was I felt that we were tackling a problem that was really a political problem through technical assistance. What needed to happen wasn't for us to do training programs for Afghan officials on how to not be corrupt. What needed to happen was President Karzai needed to say to the government, to his government, that corruption wouldn't be tolerated. And his international partners and donors needed to convey that message to him. And that wasn't happening at either of those levels.
But Christopher, is it actually corruption or incompetence often when it comes certainly to USAID? There's another story about them saying, oh, we must do something about Afghan youth. They approved $50 million over 3 years. It goes somewhere. 3 years later, they say it hasn't actually achieved anything. I mean, there are countless examples like this, not to mention buildings being built which have no use.
Yeah. Well, first of all, I'd like to agree with Dr. Naim that we do not want to substitute a narrative that says that everything is a great success with another simplistic narrative that says everything is a failure. Because there have been some successes in the cities. Access to care has probably improved in some of the hospitals as well. But I think there really is a key issue around the rural conflict-afflicted areas. And I also find it a little bit strange the way we're portraying it as being just an Afghan problem, the corruption issue, the fact that
no, not at all. We're talking about USAID and we're talking about the military-industrial complex and where this money is going.
No, but in effect, I'm not sure that some of these projects were actually designed to deliver healthcare in the first place. Some of them were designed to provide healthcare services close to a front line or in a village or in an area where there was conflict, and at the same time investigate and interrogate patients. Some of these projects were done as kind of high visibility projects. I went myself into the hospital in Lashkargah, a Boost hospital, and if you go in the basement, it's full of expensive donations from Western governments who were keen to put these products across and have a good image in the community, but they weren't necessarily what was needed in the hospital. So you have very expensive X-ray machines, scanners, etc., that have been donated. So you also have to look at the kind of assistance that's been flowing in. So you have a combination of sometimes cynical healthcare projects conducted by Western forces, which had military objectives, a combination of that with a high level of conflict in many of the rural areas around Khost, for example, north of Kunduz, and in around Helmand, where we're reporting for. And there it's true that the day-to-day reality of an Afghan in the villages outside of the main towns really hasn't changed or progressed significantly over the last decade. And we could even say that the conflict in many of these areas has intensified over the last couple of years.
Dr. Naim, though, it does seem that a lot of this aid that has been flowing in, which some of it has been useful, some of it has been a complete waste, is going to dry up slowly over the next few years. What effect is that going to have?
I believe I agree with some of the issues that were raised regarding, construction of the health facilities and the health services. Some of them the funds are flowing through the treasury of the government of Afghanistan, and some of the funds are not flowing through the treasury of the government of Afghanistan, which the government of Afghanistan does not have much control on. So therefore, I think we could have done better together. But anyway, the resources for health, what we foresee is that in the short to medium term, we have the commitments of our donors, and though in spite of the support from the USAID, as it was announced over media, we heard that it is reducing However, in the health sector, we will not be affected very badly, hopefully, because that's what we have been discussing. And similarly, our other major donors, they are committed to till 2018 and thinking the support to beyond 2018.
Christopher Stokes, there are any lessons being learned? I mean, it's not just Afghanistan, frankly. A lot of post-conflict areas we're seeing this kind of wastage and these sorts of cynical tactics being used. Are we just doomed to repeat this every time there is another conflict?
Well, not necessarily, and one of the problems is to consider Afghanistan as being a post-conflict environment, because if you're living in Helmand or in Khost or in other provinces, I think most Afghans, if you would call their environment post-conflict, when you see the stories that are described in our report, the interviews given, and the people really holding death watches over wounded family members waiting for the fighting to stop at the checkpoint, this whole notion that it's post-conflict and we should be developing a kind of long-term healthcare system, sustainable in some of these provinces, I think was probably misguided and probably driven by a political willingness.
But David Cameron said it was mission accomplished, though, this last year.
The mission was accomplished.
Yeah.
Exactly. That's exactly what, and Cameron said it himself in Helmand, actually, where we've actually seen an increase in the number of people coming in as a result of violence. And so there is this willingness to portray this as a success story. And one of the lessons has to be to look at the reality on the ground and look at the hard facts, maybe get a balance between the humanitarian and the development assistance, right? And to not provide medical assistance based on military or political objectives, because ultimately it boomerangs and actually it has a negative impact on the health providers themselves in terms of their perception towards the population.
I suppose some accountability might help as well.
By the belligerents.
But Christopher Stokes, thank you so much. Heather Barr, thank you. Dr. Ahmadjan Naeem, thank you as well. And thank you for watching. If you want to send your feedback by email to insidestory@aljazeera.net, please do. Thanks again. I'm Shihab Ratensi.